Hello everybody, welcome to week 2 of Global Health Issues and Interventions. This week we're going to talk about Chapter 6, Social Determinants of Health, and Chapter 7, Global Perspectives on Mental Health. For Chapter 6, you can see in the bottom left-hand corner, I've got a fun little drawing there of different social determinants of health. So it includes land, access to health care, family, your house, your education, the justice system. All of these different things have an impact on the type of healthcare that we receive. Globalization is part of that. So globalization is an increased awareness of health inequalities across groups. Globalization looks at these health inequalities at many levels that are affected, like the local level, the national level, and the global level. Margaret Whitehead recognized these healthcare inequalities, and what she found is that there are moral and ethical differences that exist in healthcare equality. But all of these are unnecessary, they're avoidable, they're unfair, and they're just unjust to people of the world. So what are some of these social determinants that determine the type of healthcare that we receive? Well, for some people, conditions that people are influenced with is just where they're born, where they grow, where they live, the type of work they do, and what age they are. And oftentimes these are all shaped by the distribution of money, power, and resources at their local, national, and global levels. So this is where it's really important that not only when we look at the local, national, and global levels, we're looking at the different countries across the world that are impacted on the local and national level as well. You can see that the picture on the right-hand side looks at childhood experiences, the type of housing that you have, your education, the social support, if your family has a good or bad income, if you're employed, your community, and then also the type of health access that you have to different services. So some different health inequalities that exist oftentimes are systematic inequalities. So these are things that a lot of times people can't control because it's in regards to the resources that they do or don't receive, and then also who is in power. So these are really linked with social justices, and oftentimes there's an unfair distribution of goods and services. So you can see on the right hand side I've got kind of a pie chart, and it shows, a little piece of the pie and then kind of the rest of the pie, and the rest of the pie is probably, possibly should weigh more, but in regards to systematic inequalities and health inequalities, that small piece of the pie can really have an impact on everyone else. So if goods and services are not fairly distributed and only that small piece of the pie gets the health equality, then it really does make them weigh heavier than the 3/4 of the pie. So in your textbook, table 6-1 has some health disparities in the United States compared to the most vulnerable and disadvantaged groups who are impacted by several of these health disparities. So you can see life expectancy from birth. African Americans are impacted by this. They're the most vulnerable. We know that a lot of different tribes in Africa don't always have the best medical care in regards to birth itself, and then also taking care of infants afterwards. You can see mortality from cancer, complications of diabetes, coronary disease and stroke, homicide, all in regards to the African American disadvantaged group. And then you see motor vehicular deaths and suicide from American Indian and Alaskan Native individuals. So I could keep reading, but you can see the chart here. And again, like I said, it's in your textbook, but it's a great resource to look at some of these different health disparities and how they impact specific vulnerable and disadvantaged groups in our world. So there are individual social determinants and then also group social determinants. So while we look at different parts of local, national, and global networks, we also look at specific individuals and groups. So you can see on the left-hand side in talking about individual social determinants, you have race and ethnicity. So on the chart, on the previous slide, that was a great example of race and ethnicity and those different social determinants that impact a person's health disparity. Your gender, so whether you're male or female, that can have an impact. Your employment, if there's any type of discrimination. So remember, discrimination isn't just in regards to your gender or sexual orientation. It can be race, ethnicity, social class. So discrimination can have an impact. Your social class, again, where you rank on the social hierarchy in regards to upper class, middle class, lower class. And then that is impacted too by your income. So does your income have an impact on what type of health care you receive? Is that a major social determinant for you? And then you have group social determinants. So social capital. So as I mentioned before, some African countries and tribes unfortunately don't even have the finances available or the people trained, that social capital, in order to get adequate and quality health care. Also, social networks. So do you have that support from other people in the community? Are they for what you're trying to fight or work for, or are they against you? There also might be segregation. So it can cause people to become angered and start to physically separate groups of people. And then also individual and societal variables often produce health vulnerabilities. So if things aren't consistent, if people are arguing and fighting within the community, these different variables really can produce health vulnerability. You could have good health or bad health at the flip of a coin. So I mentioned the term health disparity on the chart or table 6-1, and that is that difference in health disparity. So people not getting the same type of health care is really linked to social disadvantage and economic disadvantage. So you can see on the left-hand side here, I've got programs designed to reduce health disparities. So those different programs help those individuals of a social disadvantage or economic disadvantage to get the type of health care that they need. So some of those obstacles I mentioned, and you're going to hear them several times, so race and gender, socioeconomic status, sexual orientation, and then just their geographic location. And then some other obstacles include disabilities. So, not everybody that is disabled lives in the United States. Most of us are familiar with individuals who are disabled in the United States, but there are disabled individuals around the world. So they may have a cognitive disability, a sensory disability, or even have been born with a physical disability. So the U.S. Department of Health and Human Services worked really hard to create a national goal of eliminating these different health disparities. So they started an initiative called Healthy People. You can see at the top here, and on the right hand side I have a fun little, healthy life, next exit, go this way. So it was a national health promotion, and they really pushed for disease prevention, and they tried to identify target health indicators over a 10-year period. And so once they discovered some of these different health indicators, then they were able to work to prevent different diseases. They could kind of stop a chain of events that continue to exist. So through Healthy People, they found also that environmental effects have an impact on health. So this can include physical and social factors. So you can see on the right-hand side here, I posted a picture from Bangladesh, and it's overcrowding in Bangladesh. So the population is just so huge that people can barely get through traffic and walk, and having something like that with overcrowding, you can be exposed to pollutants with all of those different vehicles. And China also experiences pollutants with their air quality and the factories that they run. You may have unsafe homes. I'm sure many of you have seen some videos through different documentaries where people literally live in these little shacks with like 3 walls, maybe 4, and an open side. And so they're just not safe homes. And then they may live in neighborhoods with either absent or marginal resources. So it's not like they have a Walmart and a Kroger and a Walgreens, at the end of their neighborhood when they turn out of the gate. So unfortunately, not everybody is privy to that type of lifestyle, and so they don't have resources available to them at that moment. So there are different social gradients to health. So you can see on the left-hand side, I listed one that is risk factors and causes of high blood pressure. So lower social status is associated with a higher prevalence of risk factors. Now, this to some of you may sound like, oh, okay, well, yeah, if I have a lower status or a lower income, I may not have the best health. So you're right on if that's what you were thinking. So individuals of a lower status may have to deal with obesity. They may smoke to deal with stress. They may have reduced leisure time because they're constantly working, taking care of the household, trying to provide resources. They may have less physical activity. They may have an underlying illness that they're not able to get diagnosed because of that lower status. And then, as I mentioned, higher blood pressure. So if you look at the picture on the left on the slide, you can see age. Also, it could be genetic, maybe sodium, alcohol, caffeine, and then what your gender is impacts your high blood pressure. So this is called status syndrome. So when a higher social position is associated with better health, and then we see that a lower social position in the social hierarchy is less likely to meet their own needs. So they're less likely to receive the type of health care that they really deserve. So their health status is shaped by those different social determinants. So social injustice, Powers and Fadden talked about social injustice a little bit and how it impacts our health disparities. So it's not solely caused by the distribution of goods and services, as I've mentioned a couple different times, but really it's the allocation of non-distributed aspects of well-being. So that means the individual's well-being is affected by the nature of a person's social relationships with others, and that impacts the systematic constraints on the development of their well-being. So they really start to experience some adverse effects in all aspects of well-being. So maybe these individuals are victims of social subordination, discrimination, and stigma. So their well-being is affected by those social relationships. So think about your own life, right? You might have some negative impacts if somebody has, placed a negative label on you. You have, you're a part of a stereotype or a stigma. That may have an effect on your social relationship, which then in turn also has an impact on your health. So it's very important that we recognize these different social relationships and social determinants that have an impact on our well-being. So some global health inequalities within the United States, and we'll go through a couple different countries here. So if you didn't know, the United States does not provide universal health access. We're actually one of the only high-income countries that does not provide universal health care access. So we really lag behind other countries in regards to our health outcomes for this reason. So many healthcare benefits only go to high wage earners. So those individuals in, that top 1%, 25% of, some of the middle class and beyond are the ones who can afford those healthcare benefits, that insurance, those bills, the premiums, okay? So many of those benefits go to the high wage earners, and so that's where we kind of lag behind. We're basically letting people die in regards to not being able to afford healthcare. So you can see on the right-hand side, the United States, we're the richest country with the poorest health. And so we have the highest infant mortality, maternal mortality, food insecurity, obesity, okay? And anything in regards to getting some assistance, so like Medicare, Medicaid, it depends on your financial capacity of the individual. So I actually personally had to apply for Medicare after I was laid off of a job, my full-time job a couple of years ago, and it was a nightmare to go through the different type of paperwork that they require of you. And so sometimes applying for Medicare almost wasn't even worth it. But it was based basically on how much money you don't have. So, if you don't make anything, great, have some health care. If you make slightly more than what they require, good luck. Now we shop in the marketplace with the Affordable Care Act, which I'll speak of, but I just want to point out another statistic here. The U.S. spends $8,745 on healthcare per person per year. While you can see kind of blurred out, other countries don't have to pay as much on individuals. And so, you might wonder, well, why do we pay so much? And some of these different things that we don't provide is why we have some of the highest mortality rates for different reasons. So I mentioned the Affordable Care Act, otherwise known as Patient Protection and Affordable Care Act. Most of you may know it as Obamacare. It was signed by former President Obama, and it provides access to health care. It does cover most Americans, but it requires Americans to have or purchase a healthcare program. And there really hasn't been an improvement to disadvantaged groups since this was passed. So it was supposed to help kind of those individuals like myself, where I was, between a full-time job, working a couple part-time jobs teaching, and then those who didn't have a full-time job or a part-time job that maybe offered health care or insurance, and so we had to do something, right? And so that's where the Affordable Care Act came into place. But as most of us know, it's tried to been repealed in the current administration, and they haven't quite repealed it. There are some benefits and there are some negatives to it, and so it'll be interesting to see if this gets passed and what it is eventually in the future. So looking within the United States, we see minorities. So when we're talking about those different groups who are struggling to experience good health care, we're oftentimes talking about minorities. So there are greater rates of poverty and unemployment. Unemployment leads to a lack of health insurance, and these individuals generally have a shorter life expectancy. They have higher morbidity and also mortality rates. So on the left-hand side, you can see July is National Minority Mental Health Month. So I looked a little bit more specific in regards to the mental health of these minorities, and you can see that 20% of African Americans are more likely to report having serious psychological distress than non-Hispanic whites. So when I'm talking about these global health inequalities, this is why we're going to talk about Chapter 7 as well. It's not just, your health in regards to your physical health. This also includes your mental health. So if none of you have ever been to a mental health professional, you still have to run things through your insurance if you want to go to any type of counseling or therapy or receive any psychiatric drugs for anxiety, depression, etc. So, it's still impacted by the Affordable Care Act and the lack of universal health care that the U.S. doesn't provide. So you can see the two other stats here of Asian American women have the highest suicide rate of all women over age 65 in the United States. Hispanics receive mental health treatment half as often as Caucasians. So mental health treatment is not always cheap, and so that can really impact minority groups who don't have the finances sometimes to afford that type of psychological care. So then, looking at global health inequalities in European, Latin, and Caribbean countries, socioeconomic status is related to better health. So what we've seen consistently in regards to some of the social determinants, we see that perceived socioeconomic status is related to better health. So what your actual status is, or how people perceive what your status is. And the poor use fewer public resources. Oftentimes they're unable to afford them. so they use less public resources. Then we have some global health inequalities in Canada. So Canadians are unlikely to seek medical attention right away. While they do have that universal health care that the United States don't, they do have a lack of access to that health care. So weekends and evenings, most often they're not necessarily open. They may be unlikely to fill prescriptions or have certain needed procedures in Canada. And so again, there are some good things and bad things that exist to the universal healthcare. So oftentimes in these countries, the taxes are higher. And so with the taxes being higher, you have to pay higher taxes to receive those healthcare benefits. And so that also then impacts the taxes that are paid by the doctor's offices and other companies to fill prescriptions. And so that's why they're not always open on weekends and evenings, and you might have to wait for a long time for your appointments. One of the major health disparities that exist in Canada is food insecurities. So this is where food just isn't available for a lot of individuals. Oftentimes, food insecurity is common from households that are led by single mothers, Aboriginal households, and food insufficient households begin to cause individuals to have diabetes, high blood pressure, and also food allergies. And children are really impacted by having that food insufficiency, where they start to have behavioral and emotional issues, and then academic problems as well, for living in a food insecure household. Another important factor is social exclusion in Canada. So a lot of times recent immigrants and Aboriginal populations in Canada have higher employment rates, they have less income, they are part of a lower labor force participation, they have crowded homes, shorter lives, and oftentimes are more often to commit suicide. And so these individuals, especially the Aboriginal Canadians, live the shortest lives, and also have major depression, alcohol use, and sometimes childhood sexual abuse. So moving on from Canada and other countries, there are some social pathways to poor health. And so your text looks at how do we stop the cycle? What political action for healthcare access and equality can we do, and can we start to really stop this cycle of poor health? So we need to make sure that there's a fairness in the allocation of goods and services that exist. We need to make sure that it's not based on an individual's social class or income or any of those different social determinant factors. It shouldn't matter whether you're rich, poor, black, white, Aboriginal, immigrant. It shouldn't matter. The goods, services, and goodwill should be issued to everyone.